Welcome back to Uprising. I'm Sonali Kohatkar. The U.S. Department of Agriculture defines food deserts in this way, quote, urban neighborhoods and rural towns without ready access to fresh, healthy, and affordable food. Instead of supermarkets and grocery stores, these communities may have no food access or are served only by fast food restaurants and convenience stores that offer few healthy, affordable food options. The lack of access contributes to a poor diet and can lead to higher levels of obesity and other diet-related diseases, such as diabetes and heart disease. End of quote. Well, lack of access to fresh, healthy food ties together multiple social issues: public health, economic justice, children's rights, safety, and even self-determination. South Los Angeles has historically been one of the most impoverished urban areas in the nation. Today, despite a rich cultural diversity, it remains somewhat of a food desert. Now, activists want to change that. The group Community Services Unlimited has started a crowdfunding campaign to bring the first organic produce and grocery market to South LA. It's a complicated and expensive effort, but in Oakland, Northern California, one group of people has already realized its vision for an oasis in a food desert. In 2009, Mandela Foods Cooperative became the only full-service grocery store to serve West Oakland's 25,000 residents. Run by Mandela Marketplace, the store calls itself a worker-owned full-service retail grocery store and nutrition education center that fosters economic empowerment and community health. Joining me in studio today is Neelam Sharma, Executive Director of Community Services Unlimited, and from the Bay Area, Mariela Cedeno, Director of Social Enterprise and Microfinance at Mandela Marketplace. Welcome to Uprising, Neelam.
Thank you.
And also welcome, Mariela.
Thank you.
Well, let me start, Neelam, with you. First, can you tell us how serious the need in South LA is for a grocery store that delivers healthy and affordable food to its residents?
It's extremely serious. I mean, there has been so much work done in the last 10 or so years to connect diet-related illness, to what is available in someone's community. And in South LA, there is a proliferation of, like you said, fast food restaurants, what we define as junk food, essentially high calorie, low nutrition. There's a lot of convenience stores. There is really, since 1992, I mean, I moved to LA soon after that period in about 96 and heard a lot of conversation after the rebellion about all the promises that were made to bring in grocery stores. And in fact, there has been a net decrease of grocery stores in South LA. So the need is just as crucial as it has been for a very long time.
And Mariela, was your effort with Mandela Foods Cooperative in the same place several years ago that Neelam's effort is now? And how challenging was it to raise the funds for this? Because, it's not a small thing to try to start a grocery store.
Absolutely. I mean, definitely, I think we have the same roots that Neelam just mentioned, this idea of correlation of disinvested communities that were purposely redlined, and also really poor health indicators. And obviously part of that is influenced by the access to food generally, but also the over-access of healthy food, or sorry, the under-access of healthy food and the over-access of fast food and other sorts of things. We came about from a very resident-led effort. There have been several food assessments done in West Oakland around food map gapping and health indicators, and folks in the community were sort of sick of hearing the same thing, which was their experience of every day. They knew that there wasn't access to healthy food, and so they organized around that, and they came up with an entire food system to sort of solve the problems that they were facing in their own community, and the pillar of it was really a community-owned grocery store.